Infertility in women refers to the inability to conceive and carry a child to term. This is usually identified after a woman has attempted for 12 months to get pregnant via unprotected intercourse without success. Infertility is a very prevalent problem. At least 10% of women experience some form of infertility. Infertility can be treated with a variety of methods, including hormonal imbalance drugs, physical surgery, and in vitro fertilization. Female infertility can be caused by a variety of causes. Female infertility can be caused by a variety of factors, including general health, genetic features, lifestyle choices, and age. You are at risk of being infertile due to the following. So, when you come, don't forget to subscribe to this YouTube channel, BB Science Media, for more exciting and very educative videos. So, as a female, you are at risk of being infertile due to the following that we are going to talk about. So, female infertility risk factors. First one is age. Fertility diminishes progressively with age, particularly in the mid-30s and dramatically beyond age 37. Infertility in elderly women is caused by a decrease in the amount and quality of eggs, as well as health issues that impair fertility. Tobacco use. Both partners may lessen their chances of getting pregnant by smoking tobacco or marijuana. Smoking can also affect the efficacy of reproductive treatments. Women who smoke are more likely to have miscarriages. Diabetes. Diabetes is known to damage your ability to conceive and deliver a healthy baby. Diabetes is known to influence both men and women's fertility and reproductive health. Diabetes can affect hormones, causing implantation and or pregnancy to be delayed or unsuccessful. Alcohol use. There is no safe level of alcohol consumption for women during conception or pregnancy, so infertility is linked to alcohol consumption. Being overweight. A sedentary lifestyle and being overweight may raise the risk of infertility in women. Being underweight. Women with eating disorders such as anorexia or bulimia and those who adopt an extremely low calorie or restrictive diet are at risk for fertility difficulties. Exercise issues. Obesity is exacerbated by a lack of exercise, which raises the chances of infertility. In women who are not overweight, ovulation issues are less frequently linked to rigorous intensive activity. Diet. Folic acid, iron, zinc, and vitamin D12 deficiencies can all impair fertility. Women who are at risk, especially vegans, should consult their doctor about supplementation. That's taking some of these dietary supplements. Exposure to environmental toxins. How much of the worldwide decline in fertility is due to choice? A growing number of couples, particularly in developed nations, are finding conception more difficult and damaged babies more common. Metals and chemicals in air, water, food, and health and beauty aids are known to harm fertility in a variety of ways, according to research. Women are experiencing worsening anovulation, implantation issues, and fetal viability loss. Mercury, lead, and cadmium are heavy metals that can harm fertility. The effects of preconception exposure to lead, mercury, and cadmium on in vitro fertilization outcomes were investigated in a study of infertile couples. Increased cadmium levels were linked to lower egg fertilization and embryo implantation rates, according to the study. Radiation therapy or other cancer treatments. Cancer therapies are necessary for your long-term health, but they can impair the reproductive organs and glands that regulate fertility. Fertility chances might be temporary or permanent. Breast cancer and other cancers are frequently treated with hormone therapy. These factors may have an impact on your capacity to have a kid. Some of these medicines, such as tamoxifen, may not make it difficult to conceive, but they can cause birth abnormalities. Other hormone therapy can cause infertility by pushing a woman into early menopause by blocking or suppressing hormones. Depending on the type of and length of treatment, this could be transient or permanent. Radiation targeted at or near the ovaries causes enough damage to impair their function. Even if the radiation isn't directly directed at the ovaries, the rays can be absorbed and cause damage. Sexually transmitted diseases, STDs. About 30% of female infertility is due to problems with the fallopian tubes, and STDs are a common cause of tubal factor infertility. Pelvic inflammatory disease, an STD-related infection, can cause tubal factor infertility, as well as damage to the ovaries, which can lead to infertility. Some STDs, such as gonorrhea and chlamydia, can harm women's fertility. However, due to a lack of symptoms, they typically go undiagnosed, resulting in further damage. Abnormal menstruation. Ovulation, that is irregular or aberrant, accounts for about 30% to 40% of all cases of infertility. If you have irregular periods or no periods or unusual bleeding, it's likely that you are not ovulating, a condition known as anovulation. Irregular periods and menstrual disorders, are conditions that cause a disruption in a woman's normal menstrual cycle, which is important for fertility. Amenorrhea, that's the absence of menstruation. Oligomenorrhea, infrequent periods, and menorrhagia are all examples of irregular periods, that is prolonged or heavy periods. Blocked fallopian tubes. Because the fallopian tube is where sperm fertilizes the woman's egg, damage or blocked fallopian tubes are a common cause of female infertility. Pelvic inflammatory disease. Endometriosis. Prior operations. Ectopic pregnancy or tubal ligation